Testosterone replacement therapy, TRT use in men is growing and doesn't seem like it's going to be stopping anytime soon. So it's something that I've got more of an interest in, and I'm going to go through who it's appropriate for and if there's anything that you should be made aware of when it comes to using testosterone replacement therapy. Now, for context, I'm using something called GP Red Whale. So these are a private research company, I think that's the best way to put it, where they review UK medical guidelines. They also review UK literature when it comes to medical diagnostics and treatment, and they make documents which just basically consolidate all the information. Because at the moment, the UK doesn't have a general consensus, or when this was written anyway, for testosterone replacement therapy in testosterone deficiency in men. And it's a condition that is probably overdiagnosed and underdiagnosed because there was a big push, whether it was due to influencers online, pharmaceutical companies, and a lot of men went into TRT therapy. And I feel like a lot of people are using it inappropriately. However, there are people out there who don't go through the medical system and are probably undiagnosed with TRT or testosterone deficiency in the first place. So according to these, the actual prevalence of testosterone deficiency is relatively low. So on a lot of websites, they say about 1 in 4 men are affected. However, on here, it's saying 2% of men between 40 and 79. Now, these are defined it slightly differently because testosterone deficiency in a true sense is where you have a low level and it is accompanied with at least 3 signs and symptoms, whereas I think the marketing online is basically just looking at your biochemical levels, which may be low, but you may not have the signs or symptoms of testosterone deficiency. And apparently 75% of men maintain normal testosterone into old age, suggesting that testosterone deficiency is not a normal part of the aging process, unlike our female counterparts who basically lose all their hormones on average by the age of 51. So let's go on to when should you test for testosterone deficiency. So if you've got any of the common signs and symptoms, which are mainly erectile dysfunction, loss of libido, loss of early morning erections, they're the 3 most common. Then you have gynecomastia, which is the enhancement of the male breast. And then you've got sweating or hot flushes. So they're the main signs and symptoms. However, if you do have any medical conditions despite not having these signs and symptoms, then you may still warrant further investigation. So these are men with osteoporosis, either having anemia, pituitary disease, infertility, or they're taking medications. So medications come in a lot of classes when it comes to affecting the production of testosterone, which are opioids, marijuana, anabolic steroids, anti-inflammatory steroids. They also have antipsychotics. There is quite a large amount of medication. So it would be worthwhile seeing if you are on any of them forms of treatment to see if that is affecting your testosterone levels. Now, when you are going through the examination process, it is saying here that you should go and get your blood pressure, height, weight, BMI, waist circumference. Ideally, go for an examination of the external genitalia to assess volume and appearance. You should ideally go and get a digital rectal examination, which is the main reason why men probably don't go and get the prostate checked, because it's the physical part of the examination. But these are all things that are advised in accordance with blood testing. When it comes to blood testing, you should ideally get a fasted sample because it can affect your results going forward. And it should always be an early morning sample. However, if you are a shift worker, that should be give or take within 3 hours of waking. Now, the units that I'm using here are the UK derived ones. So these are nanomoles per litres. So once you've had a blood result, then you should see whether it is above 12 or below 12 nanomoles per litre. If it is below 12, you would then be suspected of having testosterone deficiency. So at that point, you would have another repeat test in 4 weeks' time, and there would be a few other blood tests that would be ordered at the same time. So you would have LH, FSH, prolactin. You may go and have liver, your diabetes, your cholesterol, all these things at this point, because then if you were to start therapy, then you've got a good baseline and we know whether testosterone replacement therapy is fit for you at that moment. And there is a large flow diagram here, but my point is when a lot of people are getting the treatments from online, yes, I've looked into some of the processes and some of them are actually quite thorough, but I do feel as though there are a lot of things that could be missed by certain companies, or they are going down different routes. So that is why I'm always a bit skeptical to just go to an online clinic without any full assessment being carried out. Now, as I mentioned earlier on, that medication can actually be one of the causes for low testosterone, but you need to categorize why you have low testosterone in the first place. So medication would fall under the category of mixed. Then you've got secondary, which are issues to do with the brain, the hypothalamus. And then you have primary, which is a lack of production of testosterone from the testes themselves. Now, with all medication, we should be trying to enhance our lifestyle, but this is not the focus of this video. So obviously try and maintain a healthy diet, make sure you are exercising, reducing stress, and make sure you are prioritizing sleep. But that is not the focus of this video. It is what happens if you were to be diagnosed as testosterone deficient and require therapy going forward. What is it that you should be looking out for? So before you go into therapy, you need to make sure that you are able to have it. So in those who have prostate cancer or undiagnosed prostate abnormalities or a history of familial prostate cancer, then they are the ones that you would look at with a bit more caution. Then you've got people who've got BPH, which is benign prostatic hyperplasia, fancy terms for an enlarged prostate, because then you can have urinary tract symptoms that relate to that. By having more testosterone, you are more likely to enhance those symptoms, and then that could cause a lower quality of life. If you have severe untreated sleep apnea, if you have severe chronic heart failure, and the one that I see a lot of, and this is why I actually done this video, is a high level of hematocrit. So hematocrit, if you were to look at this water bottle, and this is a blood vial, you would normally have 40 to 50% of it made up of cells. Now, when you are taking testosterone, the cells within your blood increase, so that would go above maybe 55, 60%. And what happens is when you have more cells within a certain volume of blood, it makes it more viscous, thick, which then leads to an increased risk of blood clots, heart attacks, strokes. So that is why we need to look into that. And the reason I'm doing this video is because last week I had 3 patients, and colleagues also had patients who were obtaining testosterone replacement therapy from private clinics. However, their blood monitoring was either absent, or when it was done, it was completely neglected. So it was putting these patients at risk. And that is something I'll come on to later on, is that these medications have not been studied for a long enough period of time within this cohort, because it's a relatively new thing or application when it comes to testosterone deficiency. Now, besides issues as to why you may not be able to start the therapy, which I've just went through, when you are on the therapy, you may get side effects. So that is polycythemia, which is what I've just said then, where you've got an increased amount of cells within the blood, which increases viscosity, the ability of it to clot. You can have acne, skin reactions. You can have gynecomastia, which I said before is the male breast development. And one thing which a lot of people weren't aware of is a lot of people use testosterone as a gel. Now, when they were applying it to the bodies and they were picking up kids, they weren't washing their hands enough. So then a lot of children were going through puberty a lot earlier than what they were meant to be doing. So it was actually then put on as a warning to make sure that you are covering the site where you apply the testosterone with clothes, and make sure you are washing your hands thoroughly to make sure you are not spreading it to other people within your area. But let's say that you've been accepted for TRT and you are then looking at how to use this safely going forward. Now, within the first year, depending on how long you are on it, you should be getting your bloods checked every 3, 6, and then at the 12-month mark. And then from that point, if you are stable, it should be on an annual basis. And the main blood tests, there are loads that you can obviously include, but the main ones to look out for are obviously the testosterone level. You need to make sure that you are replacing what you are supposedly deficient in, because if the levels are still suboptimal, it might mean that you need to increase the dose. It may mean that you need to change the form of delivery from topical to injection to oral. It's all dependent on your treatment. The next one is then hematocrit. So that is the one I've said about the red blood cells. That would normally be covered within a full blood count. And it is so important to do this one. And I think it's the one that's the most missed on any testosterone replacement therapy monitoring, is that the ability of this to cause heart attacks and strokes, viscosity of the blood. So make sure you're getting a full blood count with that involved. It should normally be about 40 to 50% depending on where you are looking at. And the last one is PSA. So this is prostate specific antigen. So it's a biomarker for your prostate gland. The higher amount of PSA normally correlates with a larger size. But do not be fooled, because you can have a normal PSA and still have cancer. And that's why there's no national screening for men with regards to prostate cancer, because a lot of cancers still exist within a normal PSA range. What we are looking at with a lot of blood tests, and same with PSA, it trends over time. And then if it is really high as a one-off result, then we will always perform a digital rectal examination, which is the physical part, which is the part we don't like. But I guarantee anyone would rather have the physical examination than to be dead probably 12 months down the line, which is the sad reality of what is happening to a lot of men. So make sure you are getting these blood tests at least every 3, 6, then 12 months once you are stable. And that's where I'm going to end this video. It was just a quick tour of testosterone replacement therapy. It's something that I'm becoming more interested in. Obviously, the older I get, the more patients I see prescribed this medication, and to see what the true reason is as to why patients are taking this. Is it because of a marketing hype, or is it because they actually are truly deficient within testosterone? And the fact that we can get these medications now so freely, they are still classed as controlled drugs. They are classed as Schedule 4, so they are things that we should be treating with respect. And if they are not monitored effectively, it can cause a lot of complications. However, if they are monitored effectively, they can be very safe and probably improve your quality of life beyond anything that you've ever experienced before. Now, with all my videos, this is just informational purposes only. It is not medical advice. And if you require medical advice, you should seek that from your local healthcare provider. If you've got any comments, questions, suggestions, put them below. I always answer them. And if you've got this far, thanks for watching, and I will see you in the next video.